Hi, everyone. My name is Tom Martin. I'm the Vice President for Client Relations here at DRG Claims Management. And as we say, your road to payment recovery really starts here. And it's something to think about when you look at your payment integrity program. And are you pulling all of the bells and whistles? Are you pulling everything that you need to in order for this to really function the way that you want to bring savings and to reduce down abrasion for your providers and ultimately your members? Well, our team, as you can see here, is a core group of folks that has a lot of experience, not only on the clinical side, but also on the business side. And to jump ahead for that, you can see that we've got coding team, we've got our auditors, we have some full-time, we have some half-time as well. These folks, we continue to expand, we continue to flex. Since I've been here in 1 year, we've had several positions open up. So it's definitely a growing business. There are a lot of people that need help with payment integrity and a lot of people that just need more insights into their data. So when we think about our team, what type of experience do we bring to the table? Well, 30 plus years of healthcare experience, and this runs the spectrum. We work with Medicare, Medicaid, commercial, TRICARE, and we've even started to work with self-insured groups as well, bringing all of that collective intelligence, experience to the table to help our clients succeed. When it comes to coding and clinical audits, which we'll talk about as well, 20 plus years there. Yes, we have coders on staff. Yes, we have nurses on staff. Our CMO is always happy to jump on the phone and talk through things with providers or clients to help them understand certain cases. And then specifically for payment integrity, 20 plus years of experience running prepayment, post-payment, COB, claim financial audits, some SIU as well, a lot of different aspects of payment integrity. Now, the numbers that you see here, yes, we need to update them. This is 2023 impact. We're refining our 2024 numbers, so we'll have that. But you can see here a substantial amount of dollars that we've gone through and audited. Very good findings that have brought saving success to groups, but at the same time were lessons learned, things that you can do to educate not only your providers, but your members, and also internally on some checks that you need to do to ensure you've got an optimal payment integrity program. So what type of audit types do we do? But at the same time, these are things to think about. Do you have these cut on in your own space, or are these things that your clients may struggle with, or internally you may even struggle with payment integrity? So as the name suggests, DRG, that is obviously core business that we audit, APR DRG for Medicaid, MSDRG for Medicare. We cover them both. We also look at APC, outpatient pricing as well. Now, when we do these type of audits, it's not just repricing. We look at it from a coding perspective. We look at it clinically, and then we will also reprice the claim as needed to ensure a full comprehensive review of that record. Now, part of DRG audits and the medical record reviews that we do, we look at short stays, which again is determining medical necessity for an inpatient stay. Should it have been billed as OBS? Should it be billed as inpatient? We look at readmission. Medicare has a readmission rule that within 30 days, if the member comes back within that 30-day period, similar diagnoses, it's a readmission. It's a duplicate case rate. That member was discharged too early, and we'll see a case of that a little bit later. Medicaid rules vary. Some are as low as 15 days. There's obviously exclusions and carve-outs, but how is your readmission program doing? That's a key item that CMS always monitors. We look at outliers and itemized bill reviews. Again, not all plans are paying cost outliers, but if and when those do come up, we audit those and, again, can go through a full review. We've also started to look into surgical implants. We've had some really interesting findings there. And looking at it at two levels. First off, just the coding perspective, black and white, yes or no, right or wrong, but also have gotten much deeper into the clinical outcomes to determine, hey, this plate that you used, you're billing us for 4 screws, so it only should be 3 screws, or maybe the wrong equipment was even used in that surgery. So some really interesting things there, and some really big ticket items as well. And then data mining and configuration. So data mining really primarily really addressing professional outpatient claims, some inpatient as well. But again, running the spectrum of MUE type items that we have to go back and look at, and more proprietary stuff that we have developed. But that's a good thing to ask yourself: is how is our data mining library? Do we have a good, robust library that is going through and capturing these claims and finding these overpayments? And then finally, configuration reviews, where our data scientists, we can run claims through and determine, hey, it looks like your contract rate that you have configured is 103%, and this looks like these are the carve-outs. Is that correct? And it could be a situation where, no, it should be configured at 101%. How did that happen? And actually create some good dialogue on making sure that the systems, the claim payment systems, are absolutely stabilized, accurate, and ready to pay those claims correctly. And then we look at skilled nursing facilities, both PDPM, which obviously is a lot more comprehensive, and yes, we do have some groups that are still dealing with RUG audits. So all of these being considered, keep in mind, and I will reiterate this again, we don't sell software. These are services that we sell to complement or either completely be that payment integrity solution for these items here. But again, ask yourself, how confident are you, how confident are your clients that we have these items under a good observation method and a good audit control system? Now, when you think about metrics, again, you always want to have these KPIs handy. When vendors are speaking about their performance or even benchmarking your own performance, how do we stand up? So right now, our findings rate, our hit rate is 40%. Just to show you some progress there, I'm coming up on my 1-year anniversary with DRG Claims Management. In March of 2025 will be my 1 year. At that time, we were a 35% hit rate. Now it's a 40% hit rate. So again, it's a constant monitoring, constant improvement of the algorithms to make sure we're delivering the best results. $20 PMPM for DRG-based audits is something to keep an eye on. What is the PMP rate that your client's hitting? What is the PMP rate that you've got internally? It's something to take a look at and say, are we hitting the industry, or are we fall short? And then you can go into it a little bit more to root cause and mitigate. Typically, we see an average of $8,000 per claim. Again, DRG based on savings. Again, short stay OBS. You've got a lot of big ticket items there that really can move that dial. And then for other KPIs that are really important, we get 98% back of our medical records. Medical records are tough to obtain. Yes, we have portals that we access. Absolutely love being able to access those. Makes life so much easier. But we'll reach out via mail, via phone calls, fax, whatever the case may be in order to obtain those records. And we jealously guard that percentage. We want to ensure that the providers know who we are. We create a good relationship with them. Let's face it, this is abrasive no matter how you look at it. So we want to make that impact as less as we can on the provider in order for them to have a good experience with us. And then finally, our accuracy rate is 98%. Again, we don't want to go below 95%, which is usually the industry standard. In some cases, yes, we are 95% on lines of business, but in the most cases, we're at 98%, and we continue to monitor that, and we continue to improve. Again, there's going to be issues that come up. Could be because of a contract, could be because of something we need to carve out. Regardless, we continue to refine the process so we keep that accuracy high. Here's some good cases to take a look at when you go back and you talk to maybe a PI leader, or you talk to finance, or you're talking to clients. So these are some good things to keep in the back of your mind. Now, what's interesting about these is that these are real cases. These are real members that had an encounter, and what we had to do to go back to find those dollars because something had happened incorrectly. For an observation claim, this resulted in $10K of savings. The patient originally, they had listed with pancreatitis, they had some kidney issues, but the problem was the inpatient criteria simply was not met. When we went through the doctor notes, the severity of care was simply not here. So we advocated to rebill that as an observation status, and we were able to save the client $10,000 on that claim. This readmission one is really heartbreaking, and this is where when members really come to the forefront. So a member went to ER, was admitted to the hospital, and had a foot infection, and they were discharged with some meds and a mediocre treatment plan. A few days later, believe it or not, the member had to come back to the hospital, and unfortunately, an amputation had to occur for this patient. Now, we went back and we saw the patient was discharged too soon, discharged too early, and therefore we were able to save on that second claim for $25,000 for the client. But this is a key issue here where you look at a situation and say, okay, we got the money back, that's great, but look at the member impact here. The member's life has been irreparably damaged because of this. So these are issues where you can take these findings, you can go back and even review the hospital. Are we having a lot of readmissions for this hospital? Are we having a lot of quality issues? Well, if that's the case, then maybe a deeper dive in a hospital needs to take place because, again, if they're not serving the members appropriately, in the end, it's just going to be a bad relationship. So one of those issues to look at payment integrity is a possibility to root cause and mitigate exactly what's happening. Then we had a cost outlier itemized bill review, close to $20,000 in savings. What had happened with this, it was routine nursing care and services, but they had basically unbundled some of these things when they were actually billed as a bundled package. And again, going through that itemized bill review, that excruciating analysis to make sure everything is looked at appropriately, again, some substantial savings here. And then our final case deals with the skilled nursing facility issue, and this is really with PDPM. So the MDS, the assessment, when the member was basically admitted and they were going to determine what that level of care was, what the treatment plan was going to be, well, they didn't document. There was no fever, there was no IV medication, no surgical incision care had been noted. So they were doing all these things for the member, but none of that had been captured in the assessment as deeming it being unnecessary care at that point, and we were able to save the client $4,200 on that skilled nursing facility claim. So again, these are real life examples, dollars absolutely in the door, but at the end of the day, this is a member impact. And so, how are our members experiencing the provider, the skilled nursing facility? These are good things to look into to root cause and determine, is the member experience being successful with these groups? And so payment integrity gives you a really good look into how are your claims functioning and how are we operating as a health plan? Are we efficient or inefficient? So good things to really dive into. These are just a sample of our clients that I'm permitted to share. Again, like I said, we run the spectrum: Medicare, Medicaid, commercial, TRICARE, even self-insured. But you can see here we have some Medicaid plans, some larger plans, some smaller plans. Just a shout out for us, we take any size of client. We're perfectly happy to entertain those groups, help them, educate them, so it's not a problem for us. And anytime anyone needs a referral or anything from our groups, you please let us know. But again, we love working with these communities, love working with our clients and really helping them grow, succeed, but most importantly, educating them on these findings so that they can improve their health plan. Now, you go to PowerPoint jail or presentation jail if you don't talk about AI. So I don't want to go to jail. So here's my AI item. So again, as I said, this isn't SaaS. This is services that we're offering. We like to say we're AI powered and human perfected. It really focuses on that human in the loop element that we want to have looking at these records. Yes, we have AI that helps with our algorithms on selecting claims. Yes, we have AI in the background that's helping us with natural language processing to help our auditors locate sepsis items quickly, pneumonia items quickly, or be able to find things in the record so that they can turn that record around, that audit, a lot faster, still accurately, for our client to obtain those dollars back. So we see AI as a great complement, by no means a replacement. It just, again, is human in the loop, but yes, we have AI in the background running with our data scientists. And again, as I reiterated, our hit rate was 35% when I started. Now it's 40%. So we see AI as a really good complement, a really good ally to helping us be more efficient, and we can pass that efficiency on to our clients. So I have to ask, Really what's next? These are things to think about. If you're running across payment integrity issues, if it's inpatient audits that are a stumbling block, reach out to us. If your clients are having issues, let us know. Love to chat about these type of things. Again, we're here to educate. We're here to improve. It's good that we're able to find some dollars here. And again, some clients, yep, find some big dollars. Some other clients, we find smaller dollars. That's fine. At the end of the day, it's improving the process and using payment integrity to improve the healthcare experience. So thank you very much for your attention. I look forward to meeting and working with all of you in the future.